Hi, Miss Hawkins. So I have trigeminal neuralgia as my disease, and my drug, the generic drug, is carbamazepine. The most popular brand name drug for this is Tegretol. So let's get into it. This is my table of contents. All right, and so um, defining trigeminal neuralgia. So defining trigeminal neuralgia is, which is also known as this tic douloureux. It is a chronic pain disorder affected by the trigeminal nerve, which is also known as the fifth cranial nerve. It is characterized by sudden severe facial pain, um, and the pain is brief, very shock-like, like electric feeling in some of the testimonies that I was reading on, and it can last anywhere from seconds to minutes. And these attacks can occur frequently throughout the day. It's not just in one episode, so it can happen quite often. And usually this affects one side of the face and is triggered by everyday routine activities. So um, the fifth cranial nerve effect provides the feeling and nerve signaling to different parts of the head and face. So, um, routine activities like eating, shaving, touching your face, dental visits, anything like that can be a trigger. Um, the pain can be can worsen over time and potentially lead to just constant pain. It is more common in women and individuals over 50, but also can occur at any age. The etiology of trigeminal neuralgia, it is the largest cranial nerve and it provides the sensory supply to the face and the motor supply of the face and the motor and the sensory supply to the muscles of mastication. There's three divisions, the ophthalmic, maxillary, and mandibular. Good way to remember that is just putting a three onto your head face like this. Ophthalmic, maxillary, and mandibular. Um, there are also three types of trigeminal neuralgia. There's the classic, which is the most common. It is caused by neurovascular compression, where the blood vessel, which is typically the superior cerebellar trigeminal, superior cerebellar artery. It compresses the trigeminal nerve root, and that compression leads to demyelination of the nerve fibers, which results in abnormal nerve signaling and the characteristic of pain. So, basically, the trigeminal nerve gets pinched and causes shooting pain. That's the classic trigeminal neuralgia. The second one is the secondary trigeminal. Those are linked to disorders such as like multiple sclerosis or any type of central nervous system disorders and or tumors or cancers. This type of trigeminal neuralgia basically it starts from the brain, like in the skull, and then like a tumor or mass is growing and then impresses on the trigeminal nerve, and that's where that pain will come from. From that pressure on the trigeminal nerve. Um, so a lot of, like, for a good example, sometimes just without cancers or any type of tumor, some types of facial trauma can cause this. And then the last type is the idiopathic. There's just no identifiable cause after an evaluation. There's just no clear finding and or answer to why that, like, for this case. But this is also the least common form. Okay, and I have a little picture down there showing the three divisions. So the effects on the body and any oral manifestations. Um, so trigeminal neuralgia really strongly just impacts the body. Um, primarily through the experience of excruciating pain in the head and face. So that just limits your daily activities. But as far as trigeminal neuralgia causing changes in the oral cavity, it it does not. It just impacts the oral health or any type of routine, such as chewing, brushing, even sometimes speaking. So it just impacts the oral hygiene practices, if you will. Um, so that just leads to or poor hygiene practices and contributes to potential oral pain with dental issues. And actually, trigeminal neuralgia before it's diagnosed is actually commonly mistaken for dental problems. A lot of patients will have unnecessary procedures like extractions or root canals because they report pain in their face and they think it's dental related before they are actually diagnosed with trigeminal neuralgia. Um, okay, so then moving on to how do we treat trigeminal neuralgia? The most common way to treat that is going to be from the medication carbamazepine. So carbamazepine is an anticonvulsant drug, um, and that's the most popular drug to use to treat trigeminal neuralgia. It stabilizes the hyperactive nerve membranes, and I have a picture right there to show you. Those are just more of the pill form. It also comes in a suspension, and I'll show you that on my visual aid and kind of go over that. So the mechanism of action for carbamazepine is it inhibits the sodium channels, which reduces the repetitive firing of action potentials and targets the excitable neurons, and which will block those voltage-gated sodium channels to decrease those synaptic communication, and that's what stops those pain signals. So it's just a reduction of pain. And like I said, like it can build a tolerance and you can start having pain. So that is the mechanism of action. Then on the pharmacokinetic side for carbamazepine, the absorption is absorbed into the body at a rate of 75 to 85% orally. The time that it takes to reach the highest concentration in the blood depends obviously on the dosage and the form, but a good example, 200 milligrams extended release can take around 19 hours to reach peak concentration, and higher doses like 800 milligrams taken every 12 hours um, result in higher peak concentrations and a shorter time to reach those peaks, around 6 hours. It's been found that eating high-fat meals can speed up absorption, but don't affect the total absorption. But typically, peak levels are reached within 4 to 8 hours. Distribution, the volume of distribution, it basically shows how widely the drug spreads in the body, was found to be around 1 liter per kilogram of body weight. And then in another study, the range was between 0.7 to 1.4 liters per kilogram. Carbamazepine also crosses the placenta, which means it can reach the baby during pregnancy. It also passes through the blood-brain barrier, but to the extent varies depending on dosage. It is metabolized in the liver, with only 5% of the drug being excreted unchanged. It undergoes autoinduction, meaning that with prolonged use, it induces its own metabolism, which can reduce the half-life over time. The body breaks down carbamazepine by turning it into a substance called CBZ10,11 epoxide. And that's done by an enzyme called CYP3A4. So the excretion of carbamazepine is primarily excreted in urine, and with a smaller portion of that being excreted in feces. The half-life is 12 to 17 hours after a single dose and may decrease with chronic use. So drug interactions for carbamazepine, these are the top three that came up in my research, is the warfarin, which is the blood thinner anticoagulant. Um, it just decreases the anticoagulant effects. So dosages and adjustments needs to be required to make sure that you're reaching therapeutic levels on either medication. Um, then the next drug interaction is oral contraceptives, which we all know is for birth control or preventing pregnancy. Um, so with that, it induces the metabolism of estrogen and progestin and um, reduces the efficacy and increases the risk of unintended pregnancy, meaning that it is null and void. Alternatives are non-hormonal contraception at that point. The third one is lithium, which is a mood stabilizer. So this, the biggest risk with this is just neurotoxic reactions like tremors and confusion or ataxia. Just monitoring for neurotoxicity is the most advised. Adverse effects. So the biggest one is drowsiness because it causes CNS depression. Um, and then we have hematological effects, which includes bone marrow suppression, kidneys or liver. Regular blood count monitoring is recommended. Um, Then we have the dermatological reactions, which is the most common thing associated with carbamazepine is the Stevens-Johnson syndrome. It's a severe skin reaction, and here is a picture right here on this slide to kind of show you an example of Stevens-Johnson syndrome and what those rashes could look like at different percentages of over the body, like 10% over the body, 10 to 30, and then over 30. It's higher risk in patients with the allele HLA-B1502, which is commonly found in Asian descent. So genetic screening is highly recommended for Asian patients before starting a carbamazepine therapy. A preventive strategy. So my preventive strategy to aid with any type of oral manifestation is basically to practice gentle hygiene, using soft bristled toothbrush, mild toothpaste, just reducing the triggers that can flare up from the trigeminal neuralgia. Alcohol-free mouthwash, avoiding very hot or very cold foods. So a lot of this is just prevention practices. Soft bristle toothbrush, mild toothpaste, mild flavoring, regular dental checkups to decrease any type of oral complications or caries, and early detection is really important, as well as stress management, and then dental appliances like mouth guards, night guards, just to minimize any type of grinding sensation with your teeth that could also flare up. Okay, and here are my surplus of references. Hi, Ms. Hawkins. This is my visual aid. Hopefully you can kind of see it, but I just wanted to show you that. Sorry, probably too bright. Let's see. Okay, so right here on this side, I have the triggers of trigeminal neuralgia. I have the display of the trigeminal nerve and the 3 branches. And right here is a really good picture of facial territories of innervation of the 3 branches. And here is a nice picture that highlights how pain can manifest with a patient with trigeminal neuralgia. And then right here, this really highlights the pain where it's most commonly misdiagnosed as dental problems from trigeminal neuralgia before it's diagnosed. A lot of patients get extractions or root canals because they report severe pain and they think it's dental related. The other side right here, I have my carbamazepine. So right here in the center, you can see that there's these are the three most common types. It's the Tegretol is the brand name. It comes in 200 oral tablet, 400 milligram oral tablet, and then a 100 milligram oral suspension. Like I said in my PowerPoint, how it works, it is an anticonvulsant analgesic, and it blocks sodium channels and the pain receptors. Another, there's adult. I have the adult and child doses right here on one of my pictures, and then I also have side effects that I went over into the PowerPoint, but basically it's the drowsiness, dizziness, because it affects the central nervous system, depresses it, so it can cause confusion. And then rare but common in Asian descent is the Stevens-Johnson syndrome, which is the severe rash that breaks out throughout the whole body. It looks like like deep red hives. And I had a picture of that in my PowerPoint. Advice when taking carbamazepine, no alcohol intake, and no sleeping pills or antihistamines or narcotics. We want to minimize the sun exposure, and you want to notify your dentist or treating physician prior to any type of surgeries. And this is a medication you do not stop abruptly because you will have to taper off of it. Some contraindications are right here at the top, and that is tetracyclic antidepressants, bone marrow depression, and use of any MAO inhibitors within 14 days. We want to be cautious with patients that are elderly with liver issues, glaucoma, kidney, and or heart. And that is my visual aid. And I want to thank you for your time. Sorry that this is a little choppy. Thank you.